Symptoms of an asthma attack. An asthma attack often begins suddenly with very typical signs. Initially, the patient may experience a dry cough or mild wheezing. These coughs are not simple like those caused by a cold but tend to last and are difficult to stop. Shortly after, a feeling of chest tightness appears, and the patient feels like their chest is being constricted, as though a heavy object is pressing down on it. As the asthma attack progresses, breathing becomes more rapid and difficult. The patient breathes faster than normal, but each breath is shallow and ineffective. A feeling of air hunger starts to develop, causing the patient to panic and breathe even faster, making the situation worse. Another very typical symptom is wheezing, a small whistling sound that occurs when the patient exhales. This sound appears because the airways narrow, causing the airflow to create a wheezing or whistling sound. Additionally, during an asthma attack, it is often harder for the patient to exhale than to inhale. This causes air to become trapped in the lungs, leading to a condition called hyperinflation. The lungs expand, pressure inside the chest increases, making breathing very difficult. If the condition is not controlled in time, the asthma attack can become more severe. The patient's lips and fingertips may begin to turn bluish due to oxygen deprivation. The body sweats profusely. The heart rate increases, and there may be a risk of losing consciousness. In severe cases, untreated asthma can lead to respiratory failure and death. Overall, the symptoms of an asthma attack not only affect the ability to breathe but also create anxiety and panic for the patient. Recognizing these signs early and treating them promptly is key to controlling asthma and preventing dangerous complications.
Global impact of asthma. Asthma is one of the most common respiratory diseases worldwide. According to statistics, it is estimated that about 300 million people are living with asthma globally. This figure not only shows the prevalence of the disease but also raises awareness about the importance of recognizing, managing, and treating asthma effectively. Although asthma can be well controlled with medication and preventive measures, about 250,000 people die each year from asthma-related complications. These deaths mostly occur in places where there is a lack of proper medical care, lack of medication, or lack of knowledge about how to manage acute asthma attacks. This indicates that asthma is not just a personal health issue but also a challenge for global healthcare systems. Asthma does not discriminate based on age, gender, or race. However, the impact of the disease is uneven across different regions. In low and middle-income countries, the death rate from asthma is much higher compared to developed countries. The reasons for this may include poor living conditions, exposure to environmental pollutants, increased smoking, and limited access to quality healthcare services. Moreover, asthma creates a significant economic burden. The cost of asthma treatment, including medications, emergency care, and hospitalizations, is estimated to amount to billions of dollars each year worldwide. Additionally, asthma causes reduced work productivity, increased school absenteeism in children, and a serious impact on the quality of life. Given the scale and consequences of asthma, the World Health Organization, WHO, and many international health organizations have recognized asthma as one of the chronic diseases that require priority control. Raising public awareness, improving living environments, expanding access to treatment, and educating patients on how to self-manage asthma are key strategies to reduce the global impact of this disease. Mechanism of asthma. Asthma is a chronic disease that directly affects the respiratory system, especially the small airways in the lungs such as the bronchi and bronchioles. These airways have a special structure consisting of an inner mucous membrane and surrounded by smooth muscle. This structure plays an important role in protecting the lungs and regulating the airflow in and out. In people with asthma, the airways are in a constant state of chronic inflammation. This inflammation causes the mucous membrane to thicken and become swollen, while the smooth muscle contracts more strongly than usual. This makes the airways highly sensitive to environmental irritants. The triggers for asthma are diverse and can be encountered in everyday life. Tobacco smoke is one of the most common factors, containing chemicals that strongly irritate the airways. Pollen and dust mites are also common allergens that can trigger asthma, especially during seasonal changes. Perfumes and strong fragrances can also provoke bronchoconstriction, In addition, vigorous physical activity, particularly in cold or dry environments, can trigger asthma attacks. Cold weather causes blood vessels to constrict and increases the sensitivity of the airways, while psychological stress leads to the release of inflammatory mediators. Even a common cold can trigger asthma symptoms in individuals with sensitive airways when a patient is exposed to these irritants. The airways constrict, the mucous membrane swells, and more mucus is produced, leading to narrowed airways. As a result, patients experience difficulty exhaling, leading to characteristic symptoms such as wheezing, coughing, chest tightness, and shortness of breath. Understanding the mechanism of asthma and its triggers is the first important step in effective disease management, minimizing dangerous asthma attacks, and improving the quality of life for patients. Physical activity. Physical exercise or intense physical activity can increase the amount of cold and dry air entering the lungs, especially when exercising outdoors in cold environments. This can easily increase the risk of an asthma attack. Furthermore, overexertion during exercise can irritate the airways and cause smooth muscle constriction. Cold weather. Cold weather causes blood vessels in the airways to constrict and increases the sensitivity of the bronchi. This increases the likelihood of constriction and airway inflammation, leading to asthma symptoms. Stress and anxiety. Psychological stress can be a strong trigger for asthma patients. When the body is under stress, stress hormones are released, which triggers of asthma. Asthma is a chronic disease affecting the respiratory system, especially the small airways such as the bronchi and bronchioles in the lungs. The disease frequently recurs and can lead to severe asthma attacks. While the exact cause of asthma has not yet been fully identified, several triggers can worsen the condition, leading to acute asthma attacks. These triggers include tobacco smoke, one of the strongest irritants for asthma patients. Tobacco smoke contains many chemicals and fine particles that can inflame the airways, making asthma attacks more severe. Even if not a smoker, individuals living in environments with tobacco smoke can be affected. Pollen. During flowering seasons, pollen is released into the air and causes allergies in many people. When asthma patients are exposed to pollen, their airways can become irritated, leading to an asthma attack. Pollen is a common trigger in spring and summer months. Dust, household dust, construction dust, or dust from vehicles can trigger asthma. The tiny dust particles enter the airways, causing inflammation, blocking airflow, and making breathing difficult. Perfumes and fragrances. While perfumes and scented products may provide a pleasant aroma, they are strong irritants for people with asthma. Chemicals in perfumes can exacerbate airway inflammation, triggering asthma symptoms. Intensify the inflammatory response and trigger an asthma attack. Common cold. A cold can worsen asthma symptoms. It causes a sore throat, nasal congestion, and increases the likelihood of bacterial and viral infections entering the airways, which can irritate and inflame the airways. The process of an asthma attack. When asthma patients are exposed to these triggers, the body responds by initiating a series of physiological reactions in the lungs. This process unfolds as follows: smooth muscle constriction. When the airways are stimulated, the smooth muscles around the bronchioles contract, leading to airway narrowing. This reduces the ability of air to flow into and out of the lungs, making the patient feel short of breath and tight in the chest. Increased inflammation. The triggers also cause inflammation in the airways. The mucous membrane inside the airways becomes swollen and produces more mucus. Although mucus helps trap dust and bacteria, during an asthma attack, this increased production worsens the blockage of the airways, making breathing more difficult.
Airway obstruction. As the smooth muscles contract and inflammation increases, the airways become blocked by excess mucus and the swelling of the mucous membrane. This makes breathing extremely difficult and leads to the characteristic symptoms of an asthma attack. Explaining the symptoms of an asthma attack are easily recognizable and are directly related to the process of smooth muscle contraction and airway inflammation. These symptoms include smooth muscle constriction, chest tightness. When the smooth muscles around the airways contract, the patient will feel chest tightness. This sensation is similar to having a heavy object pressing down on the chest, making breathing difficult. Excess mucus and inflammation, coughing, increased mucus production and swelling of the mucous membrane cause airway blockage. This leads to coughing as the body tries to expel the mucus to clear the airways. Narrowed airways, wheezing. When the airways are narrowed, the airflow through them creates a wheezing sound. This is one of the hallmark symptoms of asthma, as air has to pass through constricted airways. These symptoms can be mild or severe depending on the intensity of the asthma attack, and if not controlled promptly, they can lead to severe breathing difficulties and even death. Complications during an asthma attack. Asthma is a chronic disease that affects the respiratory system, particularly the small airways like the bronchi and bronchioles. One of the characteristics of asthma is that attacks occur suddenly and can become severe if not controlled in time. Asthma attacks not only cause discomfort for the patient but can also lead to serious complications if not treated properly. Difficulty exhaling more than inhaling. One of the hallmark signs of an asthma attack is difficulty breathing. However, while inhaling can still be done, exhaling becomes much more difficult. This occurs because the smooth muscles around the airways contract, causing them to narrow. When the patient tries to exhale, the air cannot escape easily, leading to a feeling of shortness of breath, air trapped in the lungs, hyperinflation. When the smooth muscles constrict and inflammation occurs, air becomes trapped in the lungs and cannot escape easily. This condition is called hyperinflation, a common phenomenon during severe asthma attacks. Decreased oxygen supply to the body's organs and tissues. When air cannot escape easily, the oxygen supply to the body decreases. This can cause oxygen deprivation in the organs and tissues, particularly the brain and heart. Symptoms of oxygen deficiency include fatigue, dizziness, headaches, and even fainting if this condition persists. Potential for death. If left untreated, severe asthma attacks can result in respiratory failure, which is fatal if not addressed in time.